you had some questions about maybe a UTI, or tell me about that.
So some of my friends were having a conversation. I even saw TikTok videos
Yeah.
about different causes of them.
Yes.
When people first start having sex, when
Yes.
pHs are different and things like that. And there's so much, you know, not buzz, but people want to know, like, what are some of the causes of UTIs?
Yeah. So I think that's a good question. Basically, what is a UTI? It's a urinary tract infection. That means there's bacteria in that area, right? And if you know about anatomy, the area where you urinate out of is called the urethra. It's very close to the vagina.
Yeah.
So bacteria can kind of crawl up in there. Many different reasons why. And you say people who are sexually active or just started having sex.
Right.
When you just start having sex, you may not kind of know what you're doing, kind of fumbling a little bit. And there's bacteria in the area where you're trying to figure it out.
Right.
And it can be introduced, right? People who sometimes go to the bathroom and women don't wipe themselves properly can leave bacteria, right? Pregnant women, they're susceptible to UTIs because there's a hormone that increases during pregnancy, progesterone. And it allows this particular, like the type of cells that the urethra is made out of softens. So it gets a little bit more dilated and allows bacteria to creep up in there, right? So these are things that we look for. It doesn't mean something bad is happening. It doesn't mean that you did something wrong. It just means that we need to make sure that we're vigilant about it. Multiple UTIs, then we'll send you to a urologist, which is a special doctor that takes care of that situation. But just a regular, like, hey, it burns when I pee, which is different from vaginal issues. You know, we, as a physician, we have to separate it out, right? It's so funny. It's like all in one area, but we gotta be like, your uterus is different from your vagina, different from your urethra, different from your tubes and ovaries, right? So we're thinking about it all. But with the UTI, we want to catch it early because sometimes those infections can increase. If they go undetected, it can affect your kidneys. That's what you were thinking. Yeah, I could tell. So, I mean, I think it's important to, again, and because we have telehealth now, and sometimes you can call me and say, hey, look, I'm having burning when I pee or burn after intercourse, which is sometimes could be a different thing. I may say, you know what, you don't need to come in, just leave a urine sample. I'll call you with the results. Drink water, you know, cranberry juice. People talk about that. It's a thing. It can help flush out and help with the pain a little bit. I do tell patients, if you feel like you have an infection of anything in the pelvic area, let's not have sex, because that's just going to exacerbate it even more. Okay. So, I mean, it's not something that people need to be scared of, but also something you should talk to your doctor about.
Right. You were just talking about how UTIs can mimic some other sexually transmitted infections or diseases. And that really worries me as a person who works with young people. Because if they don't actually go and get the care on time early enough, that could have dire consequences. I'm all for them getting more information in any way that they can. So could you use this time to kind of speak to a couple of things that they could be looking out for, some of the signs or symptoms?
Yeah, so UTIs I think are tricky because the bladder is near the vagina, and so they get kind of confused. So if a patient comes in for a UTI, I don't typically do a workup for STIs. But if they come in for a vaginal issue, a vaginitis that we talked about earlier, then I do a workup for that. You know what I mean? And what I'm looking for specifically would be chlamydia, gonorrhea, trichomonas. Though your face was like,
you said a trick of what? I never heard of that.
I ain't here to judge nobody.
She was like, wait. So these are the most common bacterial sexually transmitted infections or sexually transmitted diseases. The thing about trichomonas is, and again, this is no judgment, but when you're trained as a resident, if a patient, we do a swab, and you guys may have had vaginal swabs for different reasons, not just looking for STIs, but trichomonas actually on a slide, you could see it moving.
Interesting.
Yeah.
No, ma'am.
Yeah, you can. And so that's how when we look under the slide, we're looking for bacterial vaginosis, which is not an STD. We're looking for yeast, which is not an STD, but we're also looking for trichomonas, which is very distinct. And so when we think about STIs, some of them we can treat and get rid of, and some of them we can't. So I think we need to know what's the difference between the two. When I'm looking for, when someone comes in for a vaginal infection, I look for them all. But specifically, I want to rule out trichomonas, gonorrhea, and chlamydia, which now we can do a swab. I don't have to necessarily look under the microscope, but all three of those can be treated with antibiotics and they can be cured. I tell my patients their partner needs to be treated. They need to be told and they need to be treated. And then I also remind them to use condoms. Okay. And the problem with gonorrhea and chlamydia is that sometimes you don't have symptoms. Sometimes it goes unchecked. And if you don't come in and see me and I don't check it, then it can really mess up your tubes and ovaries. You can have something called pelvic inflammatory disease, which can cause fertility labor later in life. So that's an issue too. So we screen, there's a certain criteria that 25 and under, no judgment, but I screen all. If a patient asks for a STD screen, I give it to them. And if they're a new patient, I don't care if you're married or not, I ask if it's okay because I want to establish care and I want to make sure that everything is a clean bill of health. And some people refuse it and that's their choice. Now, when we start talking about the viruses, which those are bacterial, you can take a pill, get a shot, and you can get rid of that. When we talk about viruses, a lot of times they sound the same. Like HIV sounds like HPV, which also sounds like HSV. HIV, you know, people know that human immunodeficiency virus. HPV, human papilloma virus. HSV is herpes simplex virus. Those don't go away. They're treated differently, and we treat symptoms, but those are things you'll have with you all the time. We also have hepatitis B, hepatitis C. Those are viruses, and they are sexually transmitted. Hep C, you can sometimes get if you share a needle, if you're doing drugs, and sometimes Hep B, but typically they can be viral and sexually transmitted, which people are like, oh my goodness, I didn't know that. So that's a whole panel that I look for. And when we talk about herpes, you know, herpes is sneaky. So is HPV, where herpes in of itself, you can be exposed if your partner has a lesion and his lesion is on you, you can be exposed. And so I had a patient who, she asked me, she was like, you know, I have herpes. I'm in a new relationship. I don't know how to have that conversation.
I get that.
You get that. But, you know, here's my thing. I counsel them. I say, look, if you're not comfortable having that conversation with him, then maybe you're not comfortable to start having sex with him. If you're at that level of intimacy where you're saying, I'm ready to share my body with you, then I'm also ready to share these other things.
Correct.
Right? And I also say, look, you share with him. You say, look, I was exposed to this virus, and you can say this herpes virus. You can even say the age if you want. And I wanted to be upfront and let you know about what I'm dealing with. You can still have a normal, healthy sex life. You have to be able to be in tune with your body. Now, what I said herpes is sneaky because sometimes you can share the virus with someone, even if you're not having an outbreak. Less likely, but you can. But if you're having an outbreak, you're like, hey, no, it's not a good time. But if I'm that close with someone where I'm ready to be intimate and share with them, I should be able to share this with them.
Right. Absolutely.
And if we're not, on a mental health level,
Right.
that's a different conversation.
Right.
You know, how do you counsel your patient?
Yeah, I think so. I've had a few clients with bacterial vaginosis, you know, wondering, you know, even thinking theoretically, like, is this partner for me? We're supposed to be together, and I keep getting this again and again.
Yeah.
You know, maybe this is a sign that I shouldn't be with them. And then again, sort of people with herpes having that conversation about how, you know, am I ready to have sex with this person, but also mentally how that is. You know, these are people that are young. You know, the person I'm thinking of in particular, 25, you know, contracted it when she was in college. And so it's thinking about every relationship after that. She's thinking about life partnership. She's thinking, will anyone ever want to marry me? Am I worthy of love and relationship with someone, a healthy sex life, because I've gotten this from someone, you know, whatever. And so it does definitely impact mental health and sort of your sense of well-being and your, you know, self-worth.
Yeah. And, you know, Tiffany, you made me think about something. We were doing a segment of Girl Talk, and you were talking about how you grew up Catholic. I had a patient who got herpes when she was in high school. Not high school, college. And she wasn't brought up Catholic, but she was basically had a higher being and spiritual. And she felt like it was her punishment because she was having premarital sex. And I had to tell her, I said, look, I really don't think that's how God works. I mean, we have free choice and there are consequences for our actions. But I, you know, and this isn't a spiritual conversation, but I said, you know, there's been many people who've had premarital sex who did not get herpes.
Right.
You had sex with the person who had it and he exposed you. Like she carried that so far.
I'm sure.
So long. And, you know, I want to be married and I want to have kids. And, you know, and I followed up with her and she's happily married with 2 kids.
Oh, I love that.
Don't you love that? Yeah. She's happily married with 2 kids. And, you know, I assume a healthy relationship is not my business anymore, but, you know, we can't put these negative stigma on patients. We have to let them know it's okay. Now, if you out here doing what you're not supposed to be doing, I'd let you know that too, ma'am. And it's okay because I treat all types, all whatever. And I remember I had a patient who was poly, right? She had multiple partners and that's fine. That's your business. But what you are going to do is protect yourself. And she said, with my main partner, I do not. And this is what she told me. But with my other partners, I do. I said, okay. You know, I mean, I can't fight her. But if you have the information and the education to make those decisions, that's on you. You know, so, you know, herpes is one that is more than anything, I think that one is the one that really carries.
There's just such a stigma, you know, with herpes. And it feels like with a lot of my clients in particular that do have that diagnosis, that it carries them, you know, through a lifetime, it feels like. But it's so good to know that it doesn't have to.
Yeah, I agree. I totally agree. I just always want to make sure that patients know that they're okay. You're normal. This is something that we're going to deal with. And I think the biggest stigma is because they know they'll have it for the rest of their lives. But you can control it and don't let it control you. And that's the purpose of why we're doing these talks in the first place, right? Is that we want these patients to have self-advocacy, to know that you're not alone, that there are things out here for you, and that, you know, the education piece, I think that's important. You know, a lot of times we weren't having these conversations, and it was, oh my gosh, she got herpes, or you know, she got chlamydia, or whatever. I mean, it's out here, but it's okay, and it's okay for us to learn and to be able to control the narrative. That's what I feel about that. Yeah.
I love that.
Yeah.
Yeah.